Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey, welcome back to Between the Sheets. I am excited for today's topic. We're going to talk through pregnancy, postpartum, sex changes that happen during that time, and all kinds of good stuff. And we have a gynecologist with us, Dr. Erica Kesselman. Welcome. I'm so excited that you're here to talk to us about it.
Absolutely. So much changes during pregnancy, and there are so many myths and so much out there that just isn't really true. And sex is a really important thing. I love that you are highlighting that and taking away taboo. So let's tear down some taboos around pregnancy too.
Yeah, absolutely. Here's my biggest one. Are there ever any times where you shouldn't have sex when you're pregnant? Like, I know that there's probably, for the vast majority of women, pregnancy is healthy and they're good to go, but there are probably some instances where sex is like off the table. You can't have it.
Yeah, so there are a few. Early on in pregnancy, in the first trimester, or sometimes into the second trimester, if there's any issues with the placenta, where if the placenta or the connection between mom and baby, amazing organ that is a one of a kind, that is only created one time between that baby and that mom, if the placenta is ornery and decides to grow in the wrong place, or not wrong, but in an inconvenient place close to the cervix, there's a chance that it can cause bleeding. So we really want to keep the uterus quiet. We talk about putting a patient on pelvic rest, which really means not only no sex, but no orgasms, because orgasms release prostaglandins, and prostaglandins cause the uterus to contract a little bit.
Yeah.
So we want to keep the uterus really quiet, especially the lower segment of the uterus, because contractions can cause that placenta to peel up a little bit. So in conditions where the placenta is low or close to the cervix, we generally will advise pelvic rest or no sex and no orgasm. Or if the placenta has peeled up a little bit, or if there's a little bit of separation between the placenta and the wall of the uterus, sometimes that can cause bleeding. Sometimes it can't if it's higher up away from the cervix. So again, there are these certain conditions where we really just want to keep the uterus quiet, which means no prostaglandins, which unfortunately means no sex.
Yeah.
So that's sort of at the beginning of pregnancy, sometimes all the way through, depending on where the placenta is.
Okay.
And then at the end, if someone suspects that they've broken their water, we don't want you having sex at that point. Not that your partner is dirty, but we just don't want to introduce any bacteria into the vagina at that point, because the connection between mom and baby is wide open.
Right.
And so we don't want bacteria tracking up at that point.
Okay, that makes sense. So in all other cases, women should be having sex during pregnancy?
Absolutely. Although it's funny, there are definitely trends that I see. So first trimester, women their libido is a little bit lower. Hormonal changes, prostaglandins are generally, or progesterone is generally higher in the first trimester, which is oftentimes what makes us feel a little more nauseous and makes us have to pee every 2 seconds. I mean, it's not mechanical because the uterus is still really small.
Right.
But the progesterone, it can be a wicked hormone. And so a lot of times people don't feel as in the mood in that first trimester. Second trimester, I call the golden trimester. And that's when sex drive just goes up. And as long as your provider, midwife, doctor has not said, can't have sex because of XYZ, second trimester is just this amazing time where libido goes up. and mucous membranes swell a little bit.
Okay.
And with that swelling comes some like increased sensation. So
Oh,
sometimes like libido really goes up and sex feels really good. And
okay.
energy levels are higher in the second trimester too.
Yeah, and you can still breathe because you haven't hit the third trimester yet.
Yes to you. Absolutely. I always say third trimester sex is all about creativity and a willing partner and a good
Yeah.
sense of humor because it's a wild time to be having sex positionally and also just physically because of this human being that's growing in the middle of your belly.
Right.
So, second trimester is that golden trimester. Third trimester, again, it takes some creativity. The
Yeah.
other thing that I'll always caution patients, especially in the third trimester, is seminal fluid and orgasm both have a lot of prostaglandins in them. And prostaglandins can cause contractions.
Mm,
So it doesn't always cause labor, but if you've had intercourse and you're a little crampier than you were before intercourse, it's probably that. If it
okay.
doesn't get better over time, meaning like the first hour you feel like really crampy, the
Mhm.
second hour after intercourse you feel a lot less crampy, and then it kind of goes like ripples in a pool. They get further apart and weaker.
Yeah.
If it gets stronger and closer together, that could basically show that you're going into an early labor. If you're preterm, definitely call your doctor, let us know. And if you're term, know that I tell people when they say, like, how can I make this happen sooner? And I joke, what gets you into this gets you out of this. And
Yeah.
sometimes it can push you into labor.
Yeah, I remember when I was pregnant with my daughter, she's my oldest, and I'm well divorced from their father many, many years. But I turned to him and I was like, have been told that this helps, and I am past my due date, and I don't care what it takes. You're going to do this to me
Yes.
because I remember being told that, and I was like, at that point, you're just get this baby out of me.
I have a very dear friend who's also an obstetrician who was pregnant with her third, and she had gone early with her first two. And she called me like a day or two after her due date. And I mean, she's an obstetrician, she knows.
Yeah.
And she literally was crying. She goes, Erica, I think God forgot me. I think he forgot that I'm pregnant and I'm going to be pregnant forever. Like, you won't be pregnant forever. No one stays pregnant forever.
Yeah. Which
So
is a very relieving factor because those last few weeks can be very uncomfortable with just this enormity of that baby inside of you.
absolutely. I mean,
Yeah.
I had a partner at work who he used to say all the time, he's like, I don't know how you drive that thing around all day. I
Yeah.
was like, well, I sometimes feel like I need a beeper as I back up because I
Right.
feel huge.
Yeah. Yeah, absolutely. So, are there things during pregnancy that women should be aware of for having sex? Like, I know that there's suggestions to not be on your back for too long after a certain part of pregnancy and stuff. Is that included with sex?
Well, if you're lucky enough to have a partner where it takes a really long time, then hey, game on. Well, it's so we don't want you flat on your back for long periods of time. The
Okay.
reason for that, so I always like to kind of go a little bit deeper so
Yeah.
people understand why. So you have large blood vessels that go from the lower half of your body up to your heart. Once you hit 20 to 22 weeks, your uterus gets big enough that it actually compresses that blood vessel, the major blood vessel, the vena cava, and it can decrease the amount of blood supply that's going from your legs to your heart if the uterus is pressing on it. And that's why we say sleep on your side, because that kind of tips your uterus off that big blood vessel and it keeps blood supply going. When you are flat on your back on a hard surface,
Mhm.
uterus can press against those blood vessels. If you're flat on your back on a softer surface, so unless you're kind of sleeping on your college futon,
Let's
most
hope not.
likely,
Yeah.
or a super firm mattress would
Yeah.
be the same. You might have that possibility, but you're just not going to feel great on your back.
Hmm.
So I always tell people, let your body be the determining factor. You're not going to do harm. Your body is going to interrupt things before that and say, oh my gosh, I feel like we're going to pass out. And then you generally will roll onto your side. The blood goes from that lower half of your body back up to your heart pretty
Okay.
quickly. And then you're all set to go. You'll feel fine.
Yeah.
But oftentimes it's just not comfortable being on your back. And it's actually, again, unless you're putting a pillow under your hips, which will alleviate some of that, you can create a wedge with pillows so that you're angled up a little bit, or put a wedge underneath your hips. that'll actually allow for easier access with your partner if you have a male partner. If you
Yeah.
have a female partner, you're going to be more creative either way to get access. And I find that at that point, oftentimes the vibratory stimuli is too much if you're using something like a
Mm,
vibrator, just because your body is so much more sensitive.
yeah.
And there's so much more blood flow in that area. A lot
Mhm.
of times people are like, "Nah, heck no for any of the toys, just because it's a little bit more uncomfortable."
Yeah.
But doing like clitoral stimulation and
Mhm.
other, I call it outer course
Mhm.
versus penetration with
Yeah.
anything, may just feel more comfortable. And that can be in any position, but side lying tends to be a lot more comfortable.
Okay. Okay.
My patients at that point.
Yeah.
So again, it's really a lot about creativity and open-mindedness. And if you're used to missionary on your back all the time, it may be more of a struggle, but
Yeah.
tipping your hips up really is a great thing to do to allow for better access. And it gets the baby off your pubic bone,
Mm.
which also can feel a little bit better.
Yeah, that makes sense. That makes sense. I like that. So, all right. So we're kind of manipulating positions based on how we're feeling and how things are going. Are there any other tips for having quality sex during pregnancy?
So quality sex anytime
Yeah.
involves communication and foreplay. Like
Yes.
there's never too much. And sometimes people feel more tender. So it's
Mm.
similar to, I have the same conversation when patients are going through menopause or if they're going through a dry spell
Hmm.
where it just things are not feeling great. I think we sometimes forget that in the different phases of sexual enjoyment leading up to orgasm, that, there's arousal. And
Hmm.
during that arousal phase, the uterus actually moves and the vagina
Mm.
lengthens. Like
Hmm.
that's the most incredible thing. I think a woman's body is so designed for so much of this. And it's harder to move the uterus up and out of the way, which is one
Hmm.
of the reasons why penetration can feel more uncomfortable, or men will say, like, I'm bumping into something. If you have a male partner and it's penile vaginal penetration,
Right.
a lot of men feel uncomfortable both physically and emotionally, like I'm going to bump into the baby or
Yeah.
there's someone in there, or they get a little freaked out by that. So really experimenting, and if something hurts, like if he does feel like he's bumping into something and it causes deep pelvic pain for the pregnant person in the relationship,
Mhm.
then stop what you're doing. Like back up the truck, enter into sex with curiosity and not with the sort of formulaic, I do this to you, 2, 3, 4, then you do this to me, 2, 3, 4, then we do this together, 2, 3, 4, then you're done, then I'm done, and we're done, and I'm good for 2 weeks.
Yeah.
Like I have a lot of patients that come in, they're like, sex has gotten really formulaic.
Mm.
And this is just because body changes are happening. It becomes this really juicy time for curiosity and exploration
Yeah.
and communication and just therapeutic touch and sensual touch. So this is a great time to play around with what feels good on your body,
Hmm.
and having those conversations can really build intimacy,
Yeah.
which is really important during this time where often people feel very disconnected from their partners
Yeah.
because there's so much going on internally in the partner that's carrying the baby.
Hmm.
But the other partner feels kind of left out a little bit. Like all this
Yeah.
thing is happening in your body.
Right.
Nothing really has changed in my body. So having those conversations really are so key to the whole conversation and to building intimacy, which will then
Hmm.
help postpartum.
Yes.
Because I mean, we haven't even gotten into the postpartum part,
Right.
which is just wild. Like pregnancy leaves its mark on our bodies, sometimes internally, sometimes externally. Nobody gets through it without something.
Yeah.
And the gods of pregnancy are just with that. They don't give everybody everything, but they give everybody something. And so embracing the changes in your body. I have a lot of patients that feel really free during
Mm.
pregnancy because they're not trying to fit into their size 4 jeans or 8
Yep.
jeans or 10 jeans or the jeans that they've been wearing for forever. Like they just give their body the ability to do the miraculous thing of growing a human being in the
Hmm.
middle. And to add, sorry, to that can be a really important thing.
Yeah. Yeah. So what other physiological changes will women notice during pregnancy in relationship to sex? Like, does the amount of lubrication change? Does the, I remember for myself, like towards the end of pregnancy, your labias really change and become more engorged, things like that. Is there anything specific towards having sex that's going to change and maybe like, oh, be aware that this might happen?
Absolutely. I mean, lubrication does change throughout. And some of that is because as the vagina lengthens, all of the mucosal cells that are generally really square flatten out. And that's
Mm,
what produces some of the lubrication.
okay.
So I'm a big fan of slippery sex is good sex, lots of lube all the time.
Yeah.
And even if you are aroused, you don't always produce a ton of lubrication. And even if you're producing a lot of lubrication, it doesn't always mean that you're aroused. There is that sort of dysynchronicity
Yeah.
that can occur with our bodies and our brains.
Yeah.
So having lubrication available, not using a lot of the heated lubes, scented lubes, that's not the time to be experimenting with different flavored lubes. I would
Yeah.
say just a really basic water-based lube
Mhm.
or an oil-based lube is fine because you're not really worried about condoms at that point for protection of
Mhm.
pregnancy. If you have a new partner, of course, absolutely condoms for STD protection all the time. So being aware that at different times your body is going to look and feel different
Mhm.
and having that open communication with your partner really is so key. And if something hurts, stop. Don't just white knuckle through
Right.
because that then gets you into the vulvodynia and
Mhm.
dyspareunia or the spasms that can happen as your body involuntarily clenches. I tell patients a lot, like if every time I see you in the office, I end the office visit by punching you in the stomach. As the visit continues, you're going to be guarding against
Yeah.
that unhappy ending.
Right.
So sex is the same sort of thing where if you start feeling pain with intercourse and you ignore that pain, you will start involuntarily tightening those muscles and guarding against it. It's a natural thing that we do as human
Sure.
beings.
Yeah. And that's true during pregnancy and other times. I mean, we always want women to stop regardless of what's going on. If something's hurting, figure that out, investigate it, change it, add more lube, whatever, because you're right. I mean, I see women so I'm practice urology, and in urology offices, they'll come in with complaints with pain with sex and irritation afterwards and things like that. And the mental strife that comes along with that. I'm supposed to be able to have sex. I'm supposed to be lubricated. I'm supposed to do all this. And I'm not able to do that. I'm not pleasing my partner because I'm in pain. And so I just lay there and grin and bear it. It is. It's unfortunate that more women don't just stop in that moment and say, hey, like pause. Let's try some different, throw some more lube on, change position, do something
Yeah.
so that they don't get to that point.
And the thing that also there's this whole trend in, like bringing someone close to orgasm, then pulling back, that
Mhm.
kind of edging. So you don't even have to tell your partner, like, dang, that hurts, pull back. You can just pull back and
Mhm.
say, not ready yet. Like,
Yeah.
you don't, if your partner isn't amenable to that and you're having penetrative relations,
Mhm.
you can keep it sexy and you can
Yeah.
just pull back and do what feels good on your body in a way that keeps the momentum moving forward.
Mhm.
Hey, I want to try this. Hey, let's switch positions. Hey, I really want to do this. And
Sure.
then it's not like, oh, it hurts. Cause then sometimes partners will get into their head. I
Yeah.
don't want to hurt you. Am I going?
Mhm.
And then you go down into this spiral that can affect their experience as well
Mhm.
as yours. Not that you are 100% responsible for your partner's experience,
Right.
but we also have to take responsibility for ourselves. And if you feel awkward saying,
Mhm.
oh, that hurts, I'm uncomfortable, you don't have to. You can say, whoa, let's not get there just yet.
Yeah.
Time out. I want to keep this going.
Right.
And that just changes the whole mood and can keep the momentum moving forward, which
Yeah.
a lot of people feel more comfortable with.
Yeah, and that's a great point, and you can always debrief after when you're not still in the heat of the moment.
I love a good debrief.
Mhm.
Debrief with clothes on after, great.
Yeah.
Even like the next day, hey, was that good for you? Or
Right.
hey, you know what? While we were doing this, right after, I thought about blah, 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 blah.
Yeah.
And so, yeah, a good debrief is great and
Yeah.
can build momentum. And a debrief to me is always foreplay for the next time.
Yes, and sometimes leads right into the next time.
It does. I mean,
Yes.
bonus. Yeah,
Yes,
absolutely.
absolutely. And I think, during pregnancy and postpartum phase, that debrief becomes even more important because things are different and changing rapidly. And I know I'll have some women who will come in a couple months postpartum because they got their that they're ready to be sexually active. And now that it's burning when they pee every time, or it's, and so then we kind of talk through, okay, well, where's your extra lube? Because maybe you're not as good, as lubricated as you were before. And some women, have you noticed this, that some women feel a lot of shame if they're not producing enough lubricant, that,
Oh,
oh, I'm just supposed to be able to?
yes, 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 yes. There's a great book that talks a lot about that by the author's name is Emily Nagoski, and it's called Come As You Are. And
Mm,
there's a workbook that goes with it. It is phenomenal. And she talks a lot about like the dysynchronous body response to sex and what
mhm,
is projected in media and movies and narratives and books. And oh my God, I'm so wet means that I'm
yeah.
so attracted to you
Mhm,
when it doesn't always have to happen. And honestly, postpartum, I say all the time, postpartum is not, if you're breastfeeding, especially, you may not get a period. Why aren't you getting a period? Because your body is not ready to get pregnant again. We forget that as animals, our body's job is to procreate.
mhm,
And we use our bodies to recreate as well as to procreate. But our body naturally shuts off our hormones. And it's the prolactin and the oxytocin that our body produces to create and let down milk.
right.
That actually there's a shut off switch in our brain that stops ovulation.
Mm,
But
okay.
ovulation eventually will turn back on, and that's when you're fertile, and then you get a period 2 weeks after ovulation, and that's why it's not great birth control. But when it turns the ovaries off with this sort of feedback loop,
Mhm,
so the brain is producing prolactin and oxytocin. The ovaries are not then getting the follicle stimulating hormone that they would
okay.
normally get to produce the eggs. It shuts that system off. But by shutting off the ovaries, it also shuts off the androgens or the sex
Mm,
drive hormones
yep.
that we can have. So by shutting those off, it also shuts off our sex drive.
Yeah.
So I reassure a lot of my patients when they say like, I have zero desire. Is something wrong with my relationship?
Mhm,
Like there's nothing wrong with your relationship. It's your biology.
yeah.
And that's where there are switches in our brain that we might need to work a little harder to get there
Okay. Okay.
because hormonally we don't have that same drive
Sure.
to procreate that normally would keep us in that mood or get
Yeah.
us in that mood. So similar to like the first 2 weeks of our cycle during the follicular phase, I say like our plumage is out, our genes fit great. We want to reproduce because we haven't dropped the egg yet. So we're looking for a partner.
Yeah.
Once that egg drops, your sex drive decreases because your body doesn't know if you're pregnant
Mhm,
and you're about to have the next generation. So it naturally kind of dips down a little bit. Postpartum, you have that dip and it lasts longer
mhm,
because of breastfeeding a lot of the time. So, the other thing is when you think about supratentorial or in your brain, if you have a little human being that's attached to you for long periods of time, to have someone else attached to you sometimes is like, you know what, a hard stop. Like, I feel like I
yes.
smell like milk. I feel like I'm leaking from everywhere. Like, you just oftentimes aren't really in sex goddess mode at that
Yeah.
point. You're in earth mother mode at that point.
Right.
And to have someone else attached to you when you have had someone attached to you for every 3 hours, like,
Yeah.
heck no, I don't want
Right.
that.
Well, and the lack of sleep. So now you're fatigued too. But I think a lot of that comes into what you were talking about earlier with taking time for that arousal phase. So if you are wanting to explore that with your partner, you're healed up, you're healthy enough, baby's finally sleeping maybe 4 hours at a time. I don't know, and you're ready to explore that, understanding that you may need a longer arousal and foreplay time to get prepared and to get into the mood and get the good things flowing and all the hormones where you need them to be, because they're not there at that point.
Yeah. They're definitely, and if they're there, they're really low. Some people like just they're good to go.
Yeah.
The other thing that I also remind my patients when they come in for their postpartum visit is if you are going to resume intercourse with your partner, remember your body is different. And so exploring again with outer course, I usually say stimulation to orgasm 2 or 3 times before you try penetration. So you know what your body's going to feel like. If there was a tear, if there was a
Yeah.
cut, if there was any type of tear internally, if there were stitches, allowing that time to really heal and then knowing it may feel a little bit different. And so doing perineal massage and learning about your own self, this is a great time for self-exploration and masturbation. So I tell anybody that's having pain with intercourse, you need to know your body so you can be the tour guide of your body. If I were to go to Germany and I had a tour guide who had lived in Germany, I would have a much different experience on my vacation than if I went to Germany with someone who had never been there before. So knowing your country and knowing your topography and knowing your body is really important. So you could say, you know what? In this spot, it's a little bit tender. If we can try this position because that's uncomfortable for me.
Yeah.
And there may be areas that feel less sensitive that used to be super sensitive. But now it's like, I don't feel a whole lot right there.
Yeah.
Well, why? Because scar tissue doesn't have the same sensations. And as nerve endings heal, sometimes they heal with more sensitivity and sometimes they heal with less. So knowing your own body and self exploration, so important in this time period. The other thing that I like to remind people about is you have erectile tissue in your nipples. And so sometimes you can leak milk when you orgasm. And so being aware of that, and if that's something that makes you feel really self-conscious, then just wearing a pretty lacy nursing bra and feeling sexy in your body, doing things to feel sexy in your body.
Yeah.
Yeah, your abdominal muscles are going to be more relaxed. Yeah, you might still have a little bit of a belly there if you didn't before. Yeah, your belly button is going to look different. Yes, stretch marks are going to look different.
Yeah.
Your labia may look different. If there were tears, the way things come together may look different. But that doesn't mean bad or wrong. It just
Right.
means new. And what a cool opportunity to explore what your body is like after you have grown and delivered a human being.
Yeah.
And even if you don't deliver vaginally, if you have a C-section, sensation on your abdominals are going to be different. Having carried the weight of a human being in your pelvis, you can have a little bit of prolapse. Your uterus may be lower. The muscles may be more lax. The tears may have gone through different aspects of muscle. So you may not feel things the same way, but that's also a great opportunity to learn more. And if it doesn't feel good and if it consistently feels painful, even with self exploration, talking to your doctor, midwife, nurse practitioner, PA, whoever you're going to see, having that conversation is critical because pelvic floor physical therapy can fix that. Like, such a fan of pelvic floor PT
Yes.
is I mean, I'm lucky enough to have an amazing pelvic floor physical therapist in my neighboring town
Yeah.
who I've worked with for over 20 years. And so pelvic pain with postpartum
Yeah.
is very real. Vaginal pain postpartum can be really real. And so to have the tools and not to have to deal with that all alone is really important. And sometimes even postpartum, it means adding a little bit of vaginal estrogen just help with elasticity.
Yeah.
There's a urologist who I follow who I'm sort of obsessed with, Dr. Rachel Rubin, who
Yeah.
is just, oh my God,
She's fabulous.
breaking down walls with
Yeah.
a wrecking ball like Miley Cyrus wrecking
Yes.
ball. I mean, love her with my whole heart.
Yeah.
And the fact that she is bringing nomenclature to genitourinary symptoms of lactation.
Yeah.
Yes. Yes,
Yep.
yes, 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 yes. I can't say it enough. It feels like I'm having an orgasm when I talk about it.
Yeah. It's
That
amazing
is
too because
real.
I love Rachel. She's fabulous. And she has brought so much attention and knowledge to changes of the women's body throughout their life, menopause included. And I think for so long, so many of us focused on estrogen, vaginally for the menopausal changes and didn't really consider it for younger women post surgery. I work with a fabulous urogynecologist, and we start women, regardless of their age, on some vaginal estrogen after the surgeries she does, after babies are born, things like that. And so I think it's really cool how much we're using vaginal estrogen now and how much helpful that is for our patients.
Yeah. The biggest issue that I have with vaginal estrogen is it's really expensive depending on people's insurance.
Yeah.
And I feel like everybody should have access
Yep.
regardless of their payer.
Yeah, because I can get my guys testosterone real cheap.
Huh? Yeah.
Yeah. Yeah.
Yeah.
And we need it as much, you know? And the other thing that I love you talking about pelvic floor physical therapy, I've been to it myself. I send my patients all the time for various pelvic reasons. I wish it was a little bit more popular back when I had my kids that I would have been sent to. But what do you see the biggest difference is? I had C-sections with my kids, so I don't know vaginal birth. Now I labored with my daughter for a long time and ended up having a C-section. So I wasn't completely healing both sides, but a little bit because I had labored for so long. But with my son, man, I'm telling you, I would sign up for a C-section any day of the week because walking in there, full makeup, ready to go, lay down, pop my baby out. I did no work. And all of a sudden I was like back to normal. My bleeding stopped right away because they clean you out so good, all the things. And so what are some of like the biggest differences that you're seeing for women who have C-section births versus vaginal deliveries in that recovery phase?
That also sort of depends. If someone, I mean, your example was amazing. It sort of, you teed that question up for me so beautifully. Thank you. It was like a set, and I'm just going to spike that bad boy over the net. So it really depends on if you are walking in for an elective C-section versus laboring and having a C-section.
Yeah.
If you've labored for a long period of time, your body has worked really hard. Even if you've labored for a shorter period of time, you've had more vaginal exams, you have been more depleted, you haven't been eating. I mean, people who have a C-section stop eating the night before, but they generally get a decent night's sleep and they walk in fed. If you've been laboring, you are more depleted. Your body has been working. Even if you've had an epidural and you haven't been in pain, your body is still, labor is work. We call it labor and delivery because you
Yeah.
work and then have your baby. It would
Yeah.
be way cooler if it was like picnic and delivery or party and delivery,
Right.
but it's labor. So going through a labor and then having a C-section is depleting, and the recovery is a little bit longer because you're coming at it already a little bit behind the eight ball with a little bit less reserve. And our body needs, I tell patients postpartum, after you've had a baby, or if you're planning on, especially if you're planning on nursing, you get a bowl of energy every single day. A third of that energy is going to go to healing from your surgery. A third of the energy is going to go to creating milk. And you get the other third to do with what you want. And that's not a me rule, it's a Mother Nature rule.
Right.
So if you take more than the third that you're given, you may produce less milk and it will take longer to heal. And sometimes also how we go into our labor and delivery experience and how we feel at the end of it really can impact how we feel about our bodies afterwards. I mean, in my mind, having a baby is success. And it doesn't matter if your baby comes out vaginally or if your baby comes out through a C-section. It is something that can be and should be celebrated and honored. It's sacred and it's beautiful. And your body has done something incredible. There are so many people that end up with a C-section that like, well, I didn't do it. I was too weak. I'm like, no.
I was
Square
right there.
round hole. Like there are three things that lead to a vaginal delivery. One is the passageway. Well, I don't know about you, but I can't control the bones in my pelvis. Like how I was born and the bones I was given, no control over that.
Yeah.
The passenger, you have no control over that passenger either at that point. The position that that baby comes down into your pelvis in, you have no control over that. And then the power of your contractions or the power of your pushing, that's the one place where you do have some control. But if you're pushing and the baby is not in a great position, or if you have a really narrow pelvic outlet, that you can't control. So let's take the win of like, okay, we got your baby out and we have technology and we can do it in a way that is not damaging to you or your baby.
Yeah. I love that you're bringing that up because I really did, and I can sympathize with so many of these women because I felt like part of me failed in that moment. I never fully dilated. I wouldn't fully efface. They did all the pitocins, did all the things that we could do, and nothing was happening. And we couldn't, and I was a week overdue and all these things. And so we went for the C-section, and it ended up being fabulous because then I had my son, and he had a nuchal cord and all the things. So it ended up being good. But in that moment, I felt like I had failed as a woman because I didn't deliver this baby in the way that I'm supposed to, because
Right.
I've been told my whole life that I'm supposed to deliver a baby that way.
Yeah.
And so it really took me a while. So I love that you're bringing that up because it was a huge mental thing for me to get over.
Yeah. And then when we think about body, mind, spirit, when we talk about like to kind of get back to the sexual
Mm-hmm.
component, when we think our body has failed us or that we are not good enough or we didn't
Mm-hmm.
do it right, well, then why are we going to want to honor that other part of our body? And are we less than because the baby didn't come out vaginally?
Mm-hmm.
Or there are some patients who have a really painful vaginal birth or an
Mm-hmm.
instrumented vaginal birth, a vacuum or forceps. And so they then have this feeling a vacuum and forceps are great tools, but sometimes they accelerate that second stage of labor and they don't allow the pelvis to accommodate quite as quickly. And so it can be really, vaginal birth can also be very traumatic.
Yeah.
And you have this feeling of being out of control. And that then leads to, I mean, what happens when we have an orgasm? It's the
Right.
ultimate loss of control. It's that free fall feeling.
Yeah.
If it's a really good orgasm, it's like, whoa, out of your body and
Yeah.
out of your head. And if you have had an experience with your vagina where it's out of your body, but it wasn't a positive experience, then you don't have that trust in your body of, I can't let go because I can't let go because bad things happened the last time I let go or the last time I didn't have control.
Yeah.
And so really unpacking the birth experience
Mm-hmm.
can make a big difference in how you resume sexual relations.
Yeah.
And partners understanding that it really, some of it doesn't really have to do with them other than their being patient and understanding.
Mm-hmm.
So, for any of the people that are listening to this that have a partner that has gone through birth, asking questions with curiosity and just saying, hey, I was so in awe and inspired by what you did and what your body did, and being complimentary in that way, not in a pandering way, but you need to honor what happened in your partner's body to bring this human being into the world.
Yeah.
And I always tell this story when in residency, we don't get a lot of sleep.
Yeah.
And I was a resident in the 80s and early 2000s before we had all the restrictions.
Sure.
So I really wasn't getting a lot of sleep.
One reason why I'm a nurse practitioner and not a physician, because I didn't want to go through that.
It's crazy and it's rough, but sometimes you get yourself into positions where your inner dialogue comes out because your filter becomes a little bit more porous.
Yeah.
And one of the things that used to go up one side of me and down the other, and I was at a very busy teaching hospital as a resident, as most residents are,
Yeah.
and kept hearing over and over again partners say, like, gonna put an extra stitch in there, doc. And all I kept thinking was like, your partner just pushed out a human being from this, like something this big out of a hole that's this
Yeah.
big. Like, really?
Yeah.
And so I had this whole inner dialogue that would go on like, really? Are you that small? Do you want to whip it out so I can stitch to fix? Like I can fix it to accommodate
Right.
you. And it was 4 o'clock in the morning and I was closing a tear and the partner looks up at me. It's like, gonna put an extra stitch in there for me, doc. And I didn't even look up. I would just kept stitching. I was like, really? Are you that small that I have to put an extra stitch in there? Cause it's really all about you. And then there was silence in the room. And I looked up at the nurse who was helping me out. I looked up at the partner, the husband. I was like, oh my gosh, did I just use my outside voice? And everybody in the room started laughing. They're like, "Yeah, you did."
Yeah.
Like,
Whoops.
"Oh, I'm really, really sorry." And he just started laughing. He goes, "Oh, heard." And I mean, thank
Yeah.
goodness, because it's very disrespectful. But then when I pedaled it back, it was no more disrespectful than the comment.
Right. Right. Yeah.
So,
And his partner probably really appreciated you saying that. Like, no, this is about me right now, buddy.
yeah. But I mean, there's also to honor the partners that are there. Sometimes it's really traumatic for them to
Yeah.
all of a sudden see the vagina looks different at the
Yeah.
time of delivery. It becomes a birth canal and it really does look incredibly different. And so sometimes they can get into their heads. I really feel like there should be a support group for every partner who watches a birth,
Yeah.
just to allow them and give them the space to also, I think it's important. It is a partnership.
Mm-hmm.
And so, yeah, they are helpless. And if
Yeah.
they see their partner in pain, that can be incredibly scary. If
Mm-hmm.
there are retained products of conception, like
Yeah.
pieces of placenta, or pieces of membrane, or if there's heavy bleeding, or if there's a
Mm-hmm.
postpartum hemorrhage, I'm paying very little attention to the partner. And sometimes I'm going in there with my whole hand, like all the
Yeah.
way in there. And I think to myself a lot, like, how is sex ever going to be the same for you when you've seen my entire forearm in your partner?
Yeah.
And yes,
Please don't think this means you can just start fisting your wife, sir.
No, gosh, I hadn't even thought about that. But yeah, I mean, the vagina, I joke a lot that the vagina is very forgiving, both literally and figuratively,
Yeah.
sometimes too forgiving
Yeah.
sometimes. And I think that partners need to have good open communication with each other as
Yeah.
to if there is a male partner and they're going to be resuming penile vaginal penetration and he did watch the birth and he had some trauma around that, whether it was, I wasn't expecting that much blood, or I
Mm-hmm.
wasn't expecting it to look like that, or I don't know, it looks a little different now.
Yeah.
It doesn't mean that they're not attracted to their partner. It just means that they have their own body, mind, and spirit
Yeah.
issue. So, revisiting that in a really curious and gentle way and allowing each other to discuss the postpartum
Mm-hmm.
and what they how they experience the birth. I
Mm-hmm.
think it's really just like we do a debrief after sex,
Yeah.
doing a debrief after baby.
Mm-hmm.
And, we always, I have so many patients that do baby moons before the baby comes,
Mm-hmm.
but maybe carving out time 2, 3, 4 months after baby
Yeah.
and saying, let's go away for a weekend.
Mm-hmm.
And because having a baby in the room, you have someone in your room that makes noise. Babies are
Yeah.
really loud sleepers.
Yes.
And women go through, so again, going back to the menopause analogy, our brains rewire in menopause
Mm-hmm.
because of the lack of estrogen. Our brains also rewire postpartum. They've done
Mm-hmm.
MRI studies. And women focus in on very different things. Sense of smell is heightened, sense of hearing is heightened. Why? Because we're protecting our next generation. So
Yeah.
there are certain things that just we become hyper aware of and hyper acute and hyper attuned
Mm-hmm.
to. And that isn't always conducive to letting go and feeling safe with sex.
Yeah.
So getting the baby out of your bedroom or
Mm.
getting yourself away from that baby
Yeah.
for a little period of time doesn't mean that you don't love your child.
Right.
Actually, having someone else watch your child teaches your child resilience. It
Mm-hmm.
teaches them accommodation. It teaches them that you will come back. And so permanence,
Mm-hmm.
object permanence. There are really important, great lessons, but also taking time to restore and renew and reclaim your body is a
Mm-hmm.
really important part of seeing yourself again as a sexual being.
Yeah.
So taking that time both for yourself and for you and your partner can help with that reclamation process
Mm-hmm.
and help build back the intimacy that we really need. I mean,
Yeah.
I think we couple intimacy and intercourse all the time, and those really need to be uncoupled. Intimacy does not equal intercourse, and intercourse sometimes is the least intimate part of
Yes.
sex. So seeing your body again as a sexual being and not just as mom or food source or
Mm-hmm.
parent, depending on, the terms that you use in your family, seeing yourself as a sexual being again takes a little bit of time. Addressing that, especially if there has been trauma around the birth process,
Yeah.
important.
Yeah, absolutely. I think that's amazing. And I think too, like having those conversations before you even get the okay to have sex. Because just because it's been 6 weeks and you're technically cleared doesn't mean you are actually ready to do that. And I love that you said, take penetration off the table for a while and do the orgasms with clitoral stimulation and, you know, outer sex instead of inner sex. I love that because it is very scary to have sex for the first time after a kid. You feel different. You're not sure if it's going to be painful. You're not sure if it's going to feel good. And I think, kind of setting those expectations with your partner ahead of time and saying, hey, look, I have my 6-week visit coming up, but I still feel funky. I still feel a little crampy. I still feel whatever. I'm going to really need to just start really slowly. And, maybe just a finger versus a penis or a toy or whatever is all I'm going to be able to want for the first couple times. And then once I get more comfortable again, we can go down that road. I think it's so important to have those conversations before you even get to that day where you're like, all right, let's try and see what happens.
It takes more than just lighting a candle.
Yeah. Yeah, exactly. Exactly.
And
Yeah.
really,
And all the hormonal changes that women are going through too after giving birth and all of that. I think it's just there's so much. And I think you're right. Having a partner who is supportive, who will talk to you about those things makes a world of difference.
and then, I mean, we haven't even gotten into the postpartum depression that can happen afterwards and that sort of spiral that
Yeah.
can sometimes happen. And if breastfeeding is successful or isn't successful. And again, like, yes, breast milk is a great source of nutrition for your baby, but not everyone is able to do that. And then how we feel about our bodies and how we feel about our breasts and how we feel what is success.
Yeah.
And then adding one more thing onto the list of, and now I need to do this.
Yeah.
It
Yeah. It's a
really,
lot.
it is. There are so many changes that take place. And then, having that baby in the background, like you're just starting to let down and feel good. And you hear,
Right.
like, there's all of
Right.
a sudden like libido tanks, like, sorry,
Gone.
into mom mode.
Right.
Maybe we'll
Right.
try again tomorrow.
Exactly. Exactly. I really appreciate you being on here today. This is such an interesting conversation. And it's funny because when I first went into nursing school, I thought I was going to be an L&D nurse. That was what I absolutely wanted to do. I had job shadowed a nurse midwife. I was going to be an L&D nurse. I have never been an L&D nurse, not once in my life. And I have a zero desire to do it. I love babies, but I don't know. Labor and delivery never ended up being my jam, but urology is. So
And
kind of
I
similar.
almost went into urology. I was between urology and OBGYN because I liked the idea of treating someone from start to finish, being able to do things medically as well as surgically, and
Yeah.
seeing people at all different phases of their lives is really exciting to me. So there's a lot of overlap there.
There is. There is. Yeah. I don't know. I'm constantly sending patients back and forth between their GYN and myself, or their GYN sending them to me or whatever for the various issues. But I really appreciate your perspective on this and your energy and everything. So thank you so much for being here.
Thank you so much. This was so fun. And thank you for bringing this topic to light. I appreciate it because I don't think it's talked about enough with the dimensionality and the different facets that go into it.
Yeah. Awesome. Well, thank you so much for being here again. In the show notes, we'll put some links so you guys can find Dr. Erica Kesselman.
Your girlfriend's Gyno.
I love it. I love it. We'll see you guys next time. Go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.